Members of the Portfolio Committee on Health in Parliament yesterday voted on the motion of desirability regarding the National Health Insurance Bill. This was one of the steps in the NHI process that followed the government's white paper, public participation and oral admissions. Now, while government says the National Health Insurance Bill seeks to provide universal access to healthcare services to the public, different stakeholders, including non-governmental organizations, the private and the public healthcare sector, as well as academia, hold very different views on whether proposals made by the government in its white paper responded adequately to the country's health sector challenges. Now, the chairperson of the National Assembly's Portfolio Committee on Health, Dr. Kenneth Jacobs, joins us now for a conversation. Dr. Jacobs, thank you. Thanks very, very much for being with us.
Thank you very much. Good morning, and good morning to the viewers.
Yeah, so let's take it back again. Let's just give a brief reminder and a backgrounder to the NHI bill and what we're hoping to achieve with it.
Well, firstly, the NHI bill was tabled in Parliament in 2019, August. It was then through the normal joint tagging systems referred to the Portfolio Committee on Health. So it had been with us since then. We then embarked on the provincial public hearings, where we had been to 33 districts. We had listened to over 11,000 inputs made by people of the public. And we had then also had called for written submissions, of which we had received over 338,000. And after that process, we had also oral submissions. And we had just concluded that about a month ago. And the next stage of our work was to have this vote on the desirability of the bill. The bill seeks to bring equitable access to quality healthcare for all South Africans, and also to do away with this two-tier system where we have a private healthcare that provides healthcare to 16% of the population, and the public health system that has to provide healthcare to 84% of the population.
All right. I mean, that in a nutshell, I think you've summed it up. And for those that are sort of still wanting to understand what the NHI is all about, I think you've given us a great explanation. So we've now got to the point where there was the motion of desirability vote, which many are calling the next step to actually implementing NHI. So how did the committee's process work yesterday? And we saw that the majority of MPs voted in favour of it. However, opposition parties didn't. But let's just get what happened yesterday.
Well, so yesterday we had a very short meeting because the purpose of that meeting was to vote on the desirability of the bill. We had this ANC component and the member of the IFP supporting the motion, and the 4 other members who voted against it and the desirability of the bill. So a majority view was that the bill is desired, and therefore all it does, it allows us now the next step. So had the vote been such that it would have been in favor of the bill not being desirable, we would have had to table at the National Assembly all of the reports, a report, and all of the work that we had done, and the work would have ended there. All this does is it allows us to enter the next phase of this work, and which would be this deliberations on the clause by clause deliberations of the bill, and we'd hopefully be able to start that next week, and we would think that we'd be able to complete this in the next 6 weeks to 8 weeks.
All right. I mean, the NHI began talks as early as 2019 when Parliament held its first presentation by the Health Department. And the reality is, so we saw the vote taking place yesterday. It's moving closer now to the point where we may be seeing NHI coming into law. But there are many questions about the NHI and stakeholders with vested interest about the current state of public health facilities and whether this new policy will not create more malfunction if you look at the state of public facilities now. Now, the concern is whether this will honestly collapse the entire industry, including the private healthcare sector, which is currently functioning pretty well, except for its exorbitant charges. What are your views on this?
Well, firstly, there has been recognition that we do have challenges with the health system, both in the public and the private parts of the health system. So we will be reminded by the health market inquiry and the recommendations which were made there, and also with what we hear the current state of public health is. And we know that it is a challenge in terms of our fiscus also for the department to be able to provide these services and to do all of the things which people would want it to do, and which by right people have the right to receive in terms of the services. What we are doing is purely going through the phases of the work, which is the legislation. Our role is to pass this legislation or not to pass the legislation. The further work would be what the department and the National Treasury would have to come up with and find ways and means to be able to manage what it is that they ought to be doing. It is very important that there should still be a National Department of Health in the end, which would have to ensure that sufficient output is made for the people to receive good quality health care. So I don't think at this stage it is really such a big concern. It is also not anticipated to happen very quickly. It's a phased approach which government will be taking. And so yes, I don't agree with all of these doomsayers and the people who think that everything would collapse. I think there would have to be work to be done, and that all of us should participate in making this really work so that all people can have access to good health care.
And let's quiz that further, because, I mean, some of the political organizations, they did oppose it. We cannot ignore that. I mean, obviously, it's an ANC majority vote, but opposition parties are not for this, for one or other reason. I mean, we heard from the EFF yesterday saying that, contrary to what the government says, the NHI bill will primarily enrich privately owned healthcare sector even more at the expense of people that don't have medical health. And this won't resolve the crisis of infrastructure in public facilities, especially in rural and township areas. I mean, you know, what is the answer to just that one concern? Because there are hundreds, if not thousands, of concerns.
Well, currently it is exactly the same, where there is private health care, which is concentrated in the urban areas. You would hardly find a private hospital in the rural areas, so it is already underserved. Most of the public health services which are being provided are done by the National Department of Health. So I do not really understand that point, which says that it's only the private health sector that will flourish. Remember, the idea is to contract service providers for provision of services by the NHI fund. And those service providers could be anywhere. It could be very lucrative for people to go and open practices, for example, general practitioners in the rural areas. It could also be beneficial for hospitals to be, private hospitals to be opened within the rural areas. But certainly it would be mostly the work of the National Department of Health to be providing services in any case to the people of South Africa, whether that is through through service providers who work independently, or whether those would be service providers who work for the National Department of Health. I do not agree that that people in South Africa would be worse off. This is the general notion that that is spun out there, that people in South Africa are going to suffer because of this NHI fund and the purchase of services and provision of services by different people. I think that is a falsity in the sense that the services which are being provided now could only be expanded through an equitable distribution of services both within the rural and in the urban areas.
Mm-hmm. You know, the great concern as well, and I mean, you see a lot of professionals that work in the healthcare sector speaking out about this, and let's be real. If we start losing these professionals, and I'm referring to those that work in the medical sector, this is going to collapse the sector in a way where we're not going to have doctors. Now, doctors themselves have been voicing their huge concerns about this particular bill and the uncertainty around it. And I think that we have to take cognizance of that. Not only are we seeing a lot of these qualified doctors and professionals leaving the country, many are saying they don't want to be a part of this because they're very scared it's not going to work. Now, take these professionals out of the equation. That's bad for the healthcare sector, and it's also bad, once again, for the taxes that need to be paid, because there are a very small amount of tax-paying citizens here in South Africa, and these professionals are amongst them, which, of course, is going to be a big problem. What about the health industry? I mean, are you taking the doctors' views into consideration here?
Yes, certainly. We have had so many representations by many different organizations, including the doctors' groups. And that's the next stage of our discussion when we do this clause-by-clause deliberation. If you look at the percentage of spend on the general practitioners by the medical aides at the moment, according to the presentation that we had received, it is at 5.8%. Now, it means that difference is a bit of 100% and 5.8% has been spent only on the specialists and on the hospitals, the private hospitals. Now, what that does do is it is creating a big challenge for the general practitioners who are really struggling out there to make a living. It is an opportunity for them to be part of the service provision to the state through a capitation system. And it can only do well if we have these doctors being able to generate more income. Whether it is really true, it is what we read sometimes, whether it is really true that doctors are saying that they would leave South Africa. I'm not certain whether that is such, because I've never heard of anyone personally saying to me, we are going to leave South Africa because of the NHI. I think when it comes to doctors and earning their income and providing services, we are generally people who are very ethical and try to do the common good and provide good services. And the salary package, of course, is part of it, but if it is guaranteed, then it would be a completely different game. And you would know that there had been GPs who had been contracted to do work for the public health sector. And it does seem to be going on and well in certain provinces. And yes, to answer that question, whether there's going to be a brain drain, whether there's going to be doctors leaving South Africa, I think it's not going to be as extensive as what we are made to believe.
I suppose we can argue that point a lot. I mean, I personally know 5 people that left in the last year, and I'm talking about, I'm not talking about GPs, I'm talking about specialists in their field, whether it be in oncology, whether it be in pediatric cardiologists. I'm talking about people that are highly skilled. 5 people alone that I personally know that have left because they were exceptionally worried, because there just doesn't seem to be clarity. And the one clause that people are very worried about, there are 2 more points I want to bring up with you because I'm watching this time. It's not on our side, unfortunately. People are very worried about what this is going to cover. There's clause 25.4 of the bill. And this is what people are saying, is that we just don't have clarity. Everything is still so murky at the moment. What is the NH bill actually going to cover in terms of medical and expenses and things like that? And that's worrying people. Do we have clarity as yet? Well,
there will be a benefits advisory committee. I was part of the group that had looked at the basket of services a number of years ago. And so currently people are receiving good services. You haven't heard that people in the public health are not really receiving certain services as much as we are able to, well, the state is able to provide those services. We haven't seen that it is, apart from COVID now, that people have really not received the kind of services which are being referred to here, whether it is in oncology, whether it is surgical, whether it's, for example, in ophthalmology. Those services are being given to the people. And for example, we've had a large increase in cataract surgery, purely because there's been an improvement in the delivery of services in certain areas. So, yes, I don't think that there would really be such a big challenge. It is how are we going to take all of the funds which are being spent in South Africa and create an opportunity for all people to receive services. And that is work that needs to be done, whether it will be in regulations, whether contained in the regulations, or whether we would have to there would still be work. And I'm certain there's going to be a lot of work still to develop those packages.
Absolutely, there is so much work to be done. The thing is that, and I think this is where the South African public have a very big problem right now, is trusting government. We saw in 2020, where we were in a pandemic, the amount of billions upon billions of rands that were lost due to corruption, state coffers being looted literally, and South Africans left dying because this is the health sector we're talking about. And the reality is that what is going to make NHI different? And this is where a lot of pessimism lies. We've seen it in action, and it was a dismal failure in certain aspects. We saw people not necessarily being held accountable enough for the amount of billions of rands that were stolen through this time in the health industry, in the exact industry that we're now focusing in on. How is this not going to happen if NHI does come in?
Well, the bill speaks about what is proposed, that there would be systems in place and there would be a special investigating unit within the NHI fund that would look at corruption. We do understand that we've just come through a period where corruption has been exposed, and you're right, billions of rands have been lost to the fiscus, have been lost by the state. There are attempts being made, including with what the initiatives which have been brought by the president to address these problems of corruption. I think we should be a little bit more patient, having now received the reports of the Zondo Commission, for example. We should be a little bit more patient with the NPA and the work that is being done with them to bring those to account. You know, when something has happened already, for example, I would say to a patient who's now ill, and I used to, at a later stage, I would say, but this had been on the runway for quite some time. So the same with this corruption. We know it's been on the runway for a while. We're now at a point where we are arresting it, and the next point would be to recover. And I think South Africans should really try to exercise some patience with this process. And that's what we read about all the time. I agree with you that it is a major challenge, and I think that the necessary regulations will be put in place to ensure that this does not happen with the National Health Insurance Fund.
Very quick, Doc, we're wrapping. This is the last point I want from you, and very quickly, what's the next step now after yesterday's process, and by when is it estimated to be passed into policy and then, of course, come into effect? How long are we looking at?
Well, we're looking from the National Assembly side to the next 6 to 8 weeks, and then we would have to take it to the National Assembly for discussion and debate. And the process after that is to send it to the National Council of Provinces. They will go through the same system again. They would have to do the work that we had done, and they would then send it back to us at the National Assembly Portfolio Committee. And if they do make amendments, then it brings another challenge again. We'd have to take a different route. If they don't, then we would have to take it back for for decision-making within the House.
All right.
And adoption.
We leave it there. Chairperson, thanks very much. The Chair of the National Assembly's Portfolio Committee on Health, Dr. Kenneth Jacobs, giving us an update on the National Health Insurance Bill after members of the Portfolio Committee on Health in the National Assembly voted in favour yesterday.